Hi everyone, welcome to another vlog, SorishaNaidoo.com. Today I am off to Umhlanga Laser Aesthetic Clinic and put fun here. And a big thank you to Ivani. Ivani, do a quick camera rotate. who's doing a we're mock filming. We decided we're very tired of my study at home. Today we're chatting about DermaPen. Now I've had 3 sessions of DermaPen and I've managed to stay away from Botox and fillers because of it. I think it is one of the most incredible procedures that is on the market and I enjoy using it and having the treatment. When I say I enjoy having the treatment, I am a sucker for punishment, so pain for me, I've got a very high threshold. But for those who don't, there is always lidocaine. Our model in the background is currently taking off the lidocaine, which is, she's had on for about 25 minutes. So her skin is prepped, so she is numb. So she can't drink any sort of straw-like mechanism drinks in the next few hours. So I'm going to talk to Ulrika, who's going to tell us more about the DermaPen. Ulrika, how are you? Okay, good. So you've treated me with 3 sessions of DermaPen, and I've seen the results in literally the first session. So from my understanding and everyone's understanding, DermaPen is a pen with 12 needles in it, and it uses electric current as well as speed of the needles to glide up and down your skin with a substance, a gliding hyaluronic substance. And what it does is it helps to create little wounds or holes in your skin, and your skin kind of panics and says, oh my goodness, I've been hurt, send the forces, which would be the collagen. Tell us a little bit about this pen. Why does it work so well? Why does it work so quickly? Why have I seen results so quickly? And for me, one of my focuses was my under eye area, which was losing a lot of volume, which was like sagging. And within the first 4 days, I think, of using DermaPen, I saw it like puff up. So I was very impressed with that, and I'm a religious DermaPen user.
Okay, so basically, this is the DermaPen that we use. Okay. So DermaPen penetrates the skin 1,300 times per second. That's how we stimulate the collagen and elastin. Okay, so we can work up to the dermal layer, which is your deeper layer of the skin. We can work at different depths of the skin with this pen. We can go right up to a 2.5 millimeter depth.
And is that doctor related? So
this is a doctor related treatment. 2.5, from 1 to 2.5 is your medical pen. From 0 to 1 is the therapist pen. So because we have a doctor affiliated with us, we are allowed to work up to 2.5, which gives us just a better depth treatment on the skin.
So the further you go into the dermal layer, the better the result?
Yes, the more stimulation. Obviously, depending on the condition that we're treating on the skin, will depend on what we're achieving. So for instance, if you've got pigmentation, you would only treat it at a level where the melanin lies. So that's a bit more superficial on the skin. So we wouldn't have to go so deep. But if we want to really treat anti-aging, scarring, pitting, those deeper concerns, we can go right up to 2.5. Obviously prepping the skin
beforehand.
Yes.
So for me, it was anti-aging. That's why I sought this. What are the risks involved with using DermaPen? What do we have to?
So we just have to obviously be careful of sun exposure. Don't overexpose your skin to the sun afterwards. Don't do a peel too quickly. Obviously, peels and DermaPen work very well in conjunction, but we need to work according to a therapist's recommendation.
Okay. How often can you have the treatment?
The treatment should ideally be done once a month, once every 4 weeks.
She's smiling at me because I have it every 2 weeks. But I'm also treating stretch marks. So while I'm treating stretch marks, I treat my facial skin as well. And I've seen good results from it. And I'm always the exception to the rule because I always test my skin.
Okay, so with stretch marks, it's almost like we're lifting the mark from the skin, we're surfacing it. So when your stretch mark has created a tear within your skin, we are now creating again collagen and elastin, which will plump up the skin and bring it up to a surface layer. Okay, and when we get to the surface layer, we actually even out and smooth the skin because remember I said we can treat melanin, so we're treating the visibility of the stretch mark at the same time.
Okay, and the same goes with lines and wrinkles, anti-aging, all of that. Okay, great. So Dashni's been, as I said, she's had the lidocaine on for 25 minutes. She's numbed now 30 minutes, she's nice and numb, and Ulrika is going to quickly apply the gliding mechanism.
So we're going to demonstrate on the cheek area. Just cleaning off all the lidocaine.
I think what we want to do here is just to show you how it really works, and I didn't think me having the treatment done and talking to you at the same time would be beneficial. So Ken's Dash has volunteered to look flawless almost instantaneously after the treatment. So we're going to do one half, which is we'll just do the cheek area. Yes. Now the forehead is particularly sensitive in these treatments because of the bone, I'm assuming, and it's needle on bone, which is not great. But for me, the reason I like this treatment is that you can barely feel the needles gliding over because it's just so quick. As you can see, Ulrika's opening a brand new cartridge. These are disposable cartridges, so you use a new one each time you do a treatment for a client. Okay, let's do this.
So we just have to insert the cartridge into the...
And what depth are we going with Dash being a first time?
Yes, so Dash is a first timer, so we will go 0.25. Okay. Because with Dash her skin, really our concern would be, or our aim would be to even tone her skin. So we're working melanin, which is a bit more superficial.
Okay.
So that's the sound that it'll make. It's secure.
Okay, the cap is off.
Okay. And we're setting our depth.
The speed settings, how do you decide what speed to use?
Okay, so generally the face is quite an easy area to work. So we go at a medium speed, so we'll work at about a 3. The highest you can go is up to 5.
What do you use for me? I'm just curious.
A 3.
Okay.
A 3 speed.
I would like to do a 5 next time. Okay, here we go.
Yes, here we go.
Dash, how are you feeling? Okay?
I'm fine.
Nice and easy. So Ulrika's doing the first pass. You're allowed to do 2 passes, am I right?
We can do up to 3 passes.
Oh, wow.
Yes, even if you're a first timer, we can go up to 3 passes. Because we're treating the skin, we overlapping, so we're almost creating like a controlled injury, which we will call it.
What I also like about this is that you'll see with the treatment is that you can go right up and under the eye. So for me, dark under eyes, puffiness, saggy eyes, all of that is treated with the DermaPen.
Especially those clients that battle with very dark under eyes, where eye creams are just not doing it for them.
As you can see, there's no flinching. Dash is quite composed. Maybe we should tackle the forehead.
Okay, so we've done 3 passes. We work horizontally, vertically, and diagonally.
Okay, great.
Okay, so let's demonstrate the eye.
So now we're going up and close, under the eye. I think this is the favorite part of my treatment and where I see the most results is under the eye area. There we go. Okay, so there we have it, the DermaPen, my latest craze and what I love doing. And I've seen the results, so I just wanted to share that with you in my blog. Thanks guys, see you soon.